Welcome to Plastic Art Review. Let's go through the latest papers on aesthetic plastic surgery of the breast for the month of April. Now, the first two papers we're going to review are very similar. They are written by Caroline Carrigan and colleagues and deal with the validation of the breast-Q both in the reduction and augmentation modules in terms of achieving a normative value. And both have the same objective, which is to generate normative data in order to compare results of the breast-Q questionnaire. In order to do so, the breast-Q questionnaire was applied to the Army of Women, which is an online community of women both with and without breast cancer, whose main goal and objective is to promote breast cancer related research. And what they end up with is what they call the normative data of scores on both the breast augmentation and breast reduction modules of the breast-Q questionnaire in women not necessarily going to go through a breast augmentation or reduction procedure. And in this way, they can compare the results of this questionnaire on women that are going through these procedures so they can better validate the results of the breast-Q questionnaire. Now, the next paper is from the experimental section of PRS, but I believe it's extremely interesting and can have very practical implications in the near future. It's by Chinese authors Feng Lu and colleagues, and they have found out that the combination of tissue dissection and external volume expansion generates large volumes of adipose tissue. They argue that tissue dissection generates more cell-to-cell contacts and activates and triggers adipose-derived stem cells, and that is the mechanism why tissue dissection improves the volume of fat tissue generation versus expansion alone. Now, this may have a very important implication for the use of fat grafting alone in breast augmentation in the future. We all recall the excellent results from Roger Curry's publication on the BRAVA system of external volume expansion and fat grafting, both on reconstructive and aesthetic plastic surgery patients. So maybe this tissue dissection performed at the time of external volume expansion may really be an important adjunct to having this technique become more popular. And moving on to ASJ, the first paper we're going to review is by Paolo Montemuro and colleagues from Sweden, and it discusses the role of macro-textured, high cohesive extra projection anatomic implants in breast augmentation. They discuss their use on 310 patients over 7 years, and they come to the conclusion that the best indication for these type of implants are patients with the breastosis, narrow chest wall, or tuberous breast deformity. And the next paper that is very interesting is the one published by Bill Adams and colleagues, in which they compare 3D simulation versus bra sizing in order to better advise patients that are seeking breast augmentation in the final volume they wish to achieve. Now, the study is performed on 7 patients, and they take preoperative photographs of a patient with sizers using round silicone sizers over a sports bra, and they superimpose that image with the 3D simulation that the Vectra system performs. They conclude that 3D image simulation is more accurate than bra sizing as a method to help patients decide on the volume they wish to achieve after breast augmentation. And although the study is very well carried out and they admit the limitation of only including 7 subjects in their study, I believe that the biggest critique of the study is that they're comparing patient with a bra and implants to a simulation that is without a bra. I think it would be much more accurate if you could get the program to have a simulated effect of the augmented breast with a bra and then compare that to the actual image of a patient with bra sizers, because it's not the same. It's not the same. The breast is not the same with and without a bra. This has been extensively talked about by Patrick Mallucci, and how patients should be advised before they come to a surgery that the shape of the breast is not the same with the bra than without a bra. So perhaps it would be more accurate if the computer simulation would include both options. The option of simulating a 3D effect of an augmentation without a bra, and just type in the type of bra you want and simulate how that breast would look with a bra, and then compare that image to the one of a bra sizer. And in any case, I really believe that bra sizers are a very good option. I believe the system devised by Mentor, in which they use not round devices but shaped implant sizers, is more accurate. And if you use it with a bra that is not too tight and not a sports bra, the patients can really look at themselves and decide which implant size they want to have. Nevertheless, I believe it's a very interesting study, and I believe it's a good idea to try to diminish the stress some of our patients feel when they are trying to decide the final volume they're going to want to have for their breast augmentation, with tools that help them as much as possible in making that decision. And that's all for aesthetic breast surgery of the month of April. I hope to see you all next month on Plastic Art Review. Thank you very much.